All right, so we're live. We'll just give it like 5 minutes to start. All right, it seems like we have quite a few people join today. So I just want to introduce you. Hello everyone, welcome back to my medical message. Today we have Dr. Jonas Apostol, who is a cosmetic dentist, and he has a lovely presentation prepared for us today. So welcome to our platform, Dr. Apostol.
Thank you, Meg. Thank you, my medical message, for inviting me to be part of this. I'm gonna say something today, and let's start. So this is me, of course, and I have a family. I have a wife and a kid, and I have a dental clinic based here in the Philippines, and we have this hashtag. It's called Apostolified. Okay, and this is my team. I have two teams in my clinic. One is the clinical, and two would be my laboratory team. So this is my Instagram and Facebook page. You can like us on our pages, and a journey to DMD. So I graduated 2008 and took the board at the same time and got my license. And I have, of course, a lot of friends to go hang out with. I love doing missions in school or in the provinces, and also we did a lot of uh, trainings outside, you know. So this is me after I passed the board exam. So I was so thin, I actually set a goal for myself to become the better version of myself, you know. So this is my vision board 13 years ago, and it it actually gave me a lot of um, ideas on how to attack my goals. You know, you really have to be certain, and you have to see it clearly with the vision board that you want to achieve. And being a dentist is not easy, but it's just the starting point of everything. Or being a professional is just the starting point of the bigger picture or the bigger plan that you have to take. You know, this is real life, and I just have to do something. So when you create a vision board, it has to be bigger than yourself, and your intention should be very, very clear so that the mechanism will just follow. And smart goal planning is very, very important. You have to be, you know, specific about it and measurable, and you have to make sure that you are like setting a right goal for yourself, and you should never ever give up on whatever course or whatever plans that you are uh, taking in the future. So this is me. This is my crib here in my house. I still love reading. I am making myself like I'm making myself to read every single night, every single day, just to make sure that I learn every day. I always say to myself that um, education is not really, you know, during the school. It's right after. It uh, should be more. I should be more focused on that. You know, it's it's how I should change the world in my own way. And by doing that, I need to equip myself. I need to equip my mind. I need to study. I need to go to work. I need to do workout. I need to do a lot of things just to make sure that I can give my best every day in my job. So I work every day, basically. So I graduated here in the Philippines, and I actually graduated in a province here in our country. And then when I went to the big city here in the metro, I took a lot of further studies like post grad studies in surgery. This is PGH, is the biggest hospital here in the Philippines, and I took the surgical and hospital dentistry course for a year, and also I trained myself in um, periodontics. It's more of like the occlusion and the bite, and comprehensive restorative dentistry, orthodontics, and dental implants. So it got me here because of my vision. I need to create that vision board just for me to, you know, give me that guide to where I should go. I'm also a member of IAO, International Association for Orthodontics, and American Academy of Cosmetic Dentistry. And also, I'm a certified international educator for International Academy of Aesthetics. And then, so this is my journey. Then I used to rent a very, very small dental clinic. I don't have my own chairs. I don't have my own uh, staff. You know, I don't have my own patient. I'm just a young boy, went to the big city and started my journey, and that's the history. And now I have my 5 dental chairs, and we're planning to move to a bigger place, and that's it. It's not like uh, it's not like a surprise to me because we planned it. I planned it myself, and I actually got it gradually. It's because of the hard work and dedication. So cosmetic dentistry is basically whatever we do to the teeth that enhances the appearance. It's like that. But for me in my dental practice, it's more of like combination of the health, function, and aesthetics. We are talking about the bridge, the veneers, jacket crowns, composite bonding, and teeth whitening. I am making sure that everything should be healthy. I'm making sure that everything should be functional and it should be beautiful, and that is my forte. So how did I achieve this? It's not simple though. I have to fly to the States to attend a lot of great um, international educators, authors of books, and learn from the masters. And 2 years ago, I went to San Diego to meet this very, very brilliant man, Dr. Pascal Manier. Is actually a European based in the States. Is like a professor in USC, if I'm not mistaken. And he is an author of multiple books. And I'm using his book like my Bible in cosmetic dentistry. Like I read it every day, like super. I believe in his concept, and this very, very innovative, and also is a thinker, and that's what I want in an author. You know, very, very realistic. And also in 2008, I went to Chicago to meet this very, very um, known to cosmetic dentistry, Brian Lesage. He's very popular here in the Philippines as well. And a lot of authors like Dr. Terry in San Diego again. So this is like a conferences of cosmetic dentists, and then they're giving us a lot of informations about cosmetic dentistry, new trends, and new new materials to be used in creating a more beautiful result in cosmetic dentistry, because this field in dentistry is not like super old. This is like kind of new. It's because of the innovation that we have right now. And for me, as a passionate dentist, I need to make sure that I am aware and I am using the world class material and incorporate it in my dental practice and to my patient as well. And of course, I had the opportunity to shadow with Dr. Bill Dorfman. He's very, very brilliant man. He's very good. He's very generous. So he allowed me to learn from him, and I took this very, very every procedure. I took it very, very seriously and incorporated in my dental practice here in the Philippines. So yeah. So these are my patients. They are actually like beauty queen, also CEOs, and famous here in the country. So they are, from nothing, came from the province, and now they are my patients, and through hard work and dedication, that's really one of the most important thing, so that they would believe in my ability to do my thing. You know. So why cosmetic dentistry? Why cosmetic dentistry? Cosmetic dentistry is like, for me, it's I can be able to change their lives, their confidence, their self-esteem, because I've seen a lot of patients come into my clinic that they are not really confident. They're in a relationship that is abusive. They couldn't get out. It's because they thought they were so ugly. You know, it's part of uh, it's part of like the totality of yourself. So I have this opportunity to change their lives. So I am making sure that I will always do my best, that I will always equip myself. And that's the reason why I am really passionate about this, is because I want to help the community. I want to help change the world. And I'm going to show you some of my cases. But before I do that, I'm going to answer some questions here. Okay. So what is the most requested cosmetic dental procedure, and how do you go about personalizing treatment for a unique set of teeth? Additionally, what impact has COVID-19 had on your work? Wow, that is very relevant question. Yes, I usually do a lot of smile makeover cases through Veneers, and I have my steps. Like I'm gonna show you later. This is very very uh, systematic in my practice, and I do it every day. Like I do smile makeover, smile transformation every single day. And yes, this pandemic has actually brought us so many problems, especially they are afraid of going to the dentist. It's because of the notion of getting the virus. You know, it's all over the world. But because we did our part, we educate them, we innovate, we actually created a social media just to make sure that we are giving them much or enough information for them to value their teeth, because in this time of pandemic they cannot go to like places, especially dentists. It would really ruin their teeth. It's not good, it's not healthy. So we adjusted a lot. Like we use PPE, even our patients use PPEs, like everything. We secured everything just to make sure that we will not spread COVID-19. Thank you for that. Uh, how long did it take to become a cosmetic dentist, and what it's like to work in your field of uh, medicine? It took me. It's actually a cosmetic dentistry. It's part of general dentistry, which it's like more focus on smile makeover. It's like dental implant. There's no such thing as like implantologist or something like that, a specialty. But right now they are creating like a sub-spec on this, like cosmetic, implantology, and all. It took me like years. I actually got the training way back 2013, but I did not practice it full time. It's because I have so much obligation. Like I need to do a lot of surgeries before orthodontic treatment. And just 5 years ago, I did promise myself to just focus on one field, and it took me years to be able to be more comfortable with where I am right now. And it is amazing. It is amazing to be in this field. It is satisfying. You can see yourself happy about um, giving, the best smile for the patient. And also this is, at first, it in the beginning it's gonna be a very very difficult task, because you have to figure out all the materials. that will work. You're gonna have a lot of failures, but currently I'm happy. I'm happy with everything, the result, and with the learning as well. If you are a cosmetic dentist, you have to go through training for orthodontics based practices as well. I had the training before, but you don't need to. But I got the chance to train in orthodontics 13 years ago. So yeah, 12 years ago. Uh, and I practiced it. That's why it gave me a lot of ideas on how to manipulate things. I need to. I had this training abroad also for orthodontics. So it's an advantage if you have a lot of learnings in the whole aspect in dentistry, not just focusing on cosmetic, because it's really difficult to incorporate the health and function if you're not equipped enough. And that's what I've been doing for the last decade, equipping myself. And now I'm really comfortable. My first question is, what are some common procedures yeah, I actually answered that. What is this? What is the best part of being cosmetic dentist? I actually answered that already. The best part is making your patients happy. That's it. I don't really look for money or something like that. I in my practice we do a lot of free smile makeover, especially in this country. I mean, especially in my country. I love helping people. This country is not like a first world country, so a lot of people needs our service, and I don't hesitate to give them the best service. Okay, let's let me walk you through my cases here. So this is uh, mhm, what I see day to day. This one, this is my life. I do a lot of picturing. I do a lot of um, I mean, you can see in my Instagram story. It's crazy because we can be able to see these things going on, and I'm happy that I could be able to share my life to the public, especially in my profession as a dentist. It's very interesting because a lot of patients, like we are like what 7 billion people, and we have different cases, and it's totally different from every case, every race. It's different approach, and it helps me to become better. And it's quite a challenge also. Let's say, for example, they are like this. Yeah, I need to adjust. I mean, in my practice, you can see me all around the building. Like I go to my laboratory, I go to my clinic, and I attend to a lot of patients every single day, and that's it. I love music, so I love working with music. I mean, I'm working with the music that I want, and the patients wants also. So I let them sometimes choose the type of genre that they want me to play. Anyway, so case studies. So we have this indirect ceramic restorations. I do a lot of veneers or ceramic restorations, veneers, crowns, and bridges. That's the my go-to treatment always for a more lasting and more functional and more beautiful result. So this is a very, very interesting case. So this patient on his mid 30s went to my clinic with a chief complaint of having this crooked teeth, a buccal um, uh, buccoverted premolar, and lingual locked. Canine, we also have this root canal treated tooth and stains. And when I see this case, we actually uh, got all the diagnostics. It's very, very important, like clinical, radiographic, cast pictures, everything that they need to be able to come up with the best treatment plan for this patient. But this patient is like based abroad. Is he actually stayed here for like a month, so he doesn't want any braces. So the first treatment for this case is, of course, braces. We need to move the teeth, move the bone, the ligaments, and everything. But it will require a time, like a year or two, to finish this case, or more than. And also, um, I considered the aligners or Invisalign to for this case. So he doesn't want any of my treatment plan. So the reason why he went to my clinic is because of the veneers or cosmetic procedure. What can I do to his case? So I gave I gave him a choice. I gave him a choice to fix this through veneers, and it was difficult. And but we made the plan. We considered everything: the bone, the gums, the bite, the facial structure, and everything. So the first thing I do in my smile makeover treatment or smile makeover cases, I make a mock-up using composite material, just to make sure I have that idea in mind, that I can see and the patient see as well. We need to make sure that we both agree with the treatment. And there you have it. I created the mock-up, and he approved it, and I approved it, and we start the preparation, everything. And I have my own laboratory, so that's the result right there. I control everything. Like my lab guys, they follow my uh, mock-up. They follow everything, but we improve there in the laboratory that it should look natural. All the nuances of the natural teeth must be incorporated in the ceramics, and I I actually like guide them from start to finish, and we always get the result that we want. So this is the before and the after. As you can see here, it's already improved the appearance of the patient. He's confident. It's a little bit whiter and not too white, and there's a little bit of translucency in there that you can see brachymara and everything of every character of the natural teeth incorporated. And we're both happy with the result. So that's it. A very, very complicated case. I don't usually do this, but um, if the patient requested and if they don't have a choice, I need to make sure that I also deliver. And this one is on point, especially with the occlusion, because I have a T-scan. I run it there. We can be able to check, all the possible pressure and equilibrate it. Anyway, case number 2. So this patient went to my clinic um, for this concern. He actually has visited her dentist for 10 years. Imagine that, 10 years is like uh, too much. So because of the trauma from the previous experience with her dentist, um, and she never had the courage to go back to any dental clinic. But when she saw my vlog about smile makeover, changing people, daily Instagram stories that our dental practice is not like very stiff and we're happy and we're like fun to be with and we're just doing our thing. Of course, with precision and all of that, and we need to make sure the patient is comfortable. So that's the reason why he went to our clinic. And there goes the problem: missing teeth, bad cavities extended extended on the pulp, and some infections that we have to treat. As you can see here, there are like root canal treated teeth, few issues, and then we did the cleaning, deep cleaning. So I have a team in my clinic. I don't just do it myself. I have a team of periodontist, implantologist, endodontist, orthodontist, and me, cosmetic dentist, and also an oral surgeon. They're all colleagues from PGH before, so we actually uh, have our own specialty now that we focus on, not just surgery. And yeah, so for this case, it's very interesting because um, a lot of issues like the health and the function and the aesthetics, obviously. So for this case, we got all the diagnostics, X-ray, and I actually um, advise the patient to have a dental implants on her teeth, but yeah, it's very expensive and she can't afford it, and we actually make a treatment plan for her based on the budget. Okay, but that's why we come up with the bridge and the combination of bridge and veneers. So I did a smile design again using composite, and as you can see here, it's more symmetrical, it's more balanced, it's natural looking, and it's in harmony in the patient's face. When I do cosmetic dentistry, it should be in harmony in the face. It shouldn't be like a beautiful sets of teeth, because it's going to be a failure if it's not if the teeth will not complement the face. And also the color is very, very important, and the personality. So I did the preparation. So as you can see here, a lot of issues like cavities. So I need to remove cavities. I need to remove any unsound structure of the teeth, because it will pose a threat in the future if we place in the veneers. And then there's a demineralized area, there's cavity, it's not going to be healthy. So the secret to like longevity of any indirect restoration or direct restoration should be healthy, remove all the unsound, unhealthy structures, and place in your ceramic perfectly. So that's the after. As you can see here, it's more balanced and more beautiful. It's natural looking, and the translucency is very evident, and especially in the incisal area there. And as you can see, we change everything. Okay, so she has a low lip line, so you won't be able to notice any sign of caries. It's like the natural teeth. It's like a normal set of teeth, Okay. So she's happy with the result, and I'm also happy. And I think it actually gave more quality in her life. It's because of a more healthier, more functional, and more confidently beautiful smile. So case number 3. So this patient is like on her mid-20s, but the damage is evident. She she had a missing teeth, unfortunately, on the front teeth, and it's it's actually giving her a lot of self-esteem problem. It's because of this type of condition, and you can see a lot of cavities going on. She's a very beautiful woman, but because of the here in the Philippines, it's really different. It should be a necessity, but a lot of people couldn't afford this good dental treatment for their cases. So I did the mock-up using Composite just to make sure that everything should be um, in harmony in the face. So after the mock-up, we did the preparation and modification in the laboratory. I made sure also that it should be beautiful in her face. She has a fair skin tone, and so I gave her a more whiter shade, and she loved it. And that's it. It changes her life, and this is like a bridge case, a combination of bridge and veneers. And this is what I do every day. Every day. Okay, so before I proceed with the direct composite veneers, I'm gonna answer some questions here. Did you ever consider another medical field prior to this one? And if so, what made you switch to this one? Well, I was not a brilliant student when I was in high school. Like, I actually love music. I mentioned that a while ago. I love music. I love cooking. So I thought I am going to be a musician, and I thought I'm going to be a chef or something like that. But my mother, my mother doesn't like the idea. They actually asked me to like find another course that would make me you know that would make me or that would create a better path. Here in our country, it's different. It's like before, when during my time, it's different. So that's why I consider dentistry, and after considering and after attending dentistry, I tried to go to medical school to become a surgeon, because um, I love anatomy and physiology. I love medicine. In we have a course in dentistry as well, that we dissect human cadaver, and that's the first year and second year. And I was really astonished about the about medicine, and I really wanted to venture on that. But when I took the post-grad um, course in surgery in PGH, I realized that medicine is not for me. Even surgery is not for me. It's crazy, because I'm not really certain before of what I really want in my life, and it gave me more clarity as I took a lot. As the years passed by, I took a lot of trainings and realized that this one is for me. But you know, going back to the vision board, you have to have that, and you have to get it. And you have to make sure that you're clear enough with your intention. How is the composite used for sculpting is able to survive wear and tear? Uh, it actually has limitation with the composite. You can't be able to like do a lot of modification on the teeth, like the height and the length, and expecting not to to break it. It's because the composite, it's not as hard as porcelain or zirconia. And but the key here to success of every direct composite veneer is the occlusion, and make sure that the patient is wearing night guard. And we have to make sure also that the habits are not going to create damage on the veneers, especially the direct veneers. And also, in this time of like modern dentistry, we have this manufacturer that creating a more stable, more durable composite as compared before. Like 10 years before, the composite now is much better. The bonding is much better, because of the because of the innovation of the companies in dentistry. What is the state of our technology in your profession? Hmm? I use a CAD CAM in my clinic. I have my own CAD CAM. I have my own laboratory. It's fairly new in dentistry. It's not new, but it's yeah. Most of the clinic doesn't have CAD CAM machine, but I do have. T-scan machine wherein we can be able to check the force applied on every specific teeth. That's why we can be able to see if what's causing the damage of the teeth, what's causing the TMJ problem, what's causing the failure, the debonding. It's about balancing in dentistry. And fortunately, I have that machine in my practice, and I incorporate that, just few years ago, 3 years ago. What makes a cosmetic dentist different from an orthodontist? Are cosmetic dentistry modifications purely aesthetic, or they have any health benefits? Yes. It's far different from orthodontists, because in orthodontics, they actually move the teeth. That involves the ligaments, the bone. There's a resorption, there's a bone deposition, and it takes time. And while in cosmetic dentistry, we actually more of like change the appearance of the teeth, the texture, the alignment, without moving the bone, without moving the ligaments in there. And with cosmetic dentistry, in my practice, I do health function aesthetics. I don't go for aesthetics alone, because it's not gonna last. It's not gonna last. It's your teeth, it's your mouth. You are actually wearing it. You're using it every day, every single time we eat. So we need to make sure that it is functional and healthy at the same time, because we want to prolong the life of our teeth. We need to make sure that we use our teeth for the rest of our lives. I mean, that's really the idea, but taking care of it is very, very important. Okay, let me discuss about direct composite veneers. So direct composite veneers is one of the options that we give to our patients. It's because it's a lot cheaper, and it's easier to manipulate. The patient come in, and then he comes out with a beautiful set of teeth already. So it's a 2-3 hour procedure for a smile makeover. And then usually in my clinic, I do 2 appointments. First is to create the smile, everything, and then polish it. And the second one for recall, night guard, and also remove all the excess cement and a little bit of modification if the patient requested a little bit like shorter, or the character of the canines, and in totality of her face. That's it. And so this one is very, very interesting. As you can see, the upper teeth has composite already for like 5 years. And then a lot of issues like plaque, and the teeth, the lower teeth is actually whiter than the upper, and it's edge to edge. It's prone to breakage. It's prone to damage if that is your condition. So we need to make sure that we change this. We have to make sure that we um, improve not just the appearance but also the health and the function as well. So for this case, I used composite. It's three types or three different shades to create a more natural looking result. So this is the after. So it's a 2-3 hour procedure. We've been able to finish it on the same day, and then she's happy with it. And in the principle of dentistry, especially in cosmetic dentistry, the upper teeth should be like a one shade whiter than the lower, because when you speak, every time, the lower is more prominent. Lower teeth are more prominent. That's why upper should be like a little bit whiter. It's like a principle in cosmetic dentistry. Case number 5, this is a vlogger, a beauty vlogger. So a lot of beauty vloggers actually come into my clinic to have their teeth done because they can be able to incorporate the dental aesthetics and the health as well. So this one from uneven um, uneven shades and also distribution of the teeth. I did the direct composite veneers for 4 teeth here just to balance everything and um, more natural looking sets of teeth. And this one is another beauty vlogger. So before, she had this teeth which is very a little bit protruding, and it's not visible when she speaks. So I did a little bit of um, direct veneers also. So modification in relation to her face, skin tone, and the curvature of the lips, and also the distribution of the smile. A little bit sexier smile to make sure that it complements with the face. So in dentistry, in my field, cosmetic dentistry, innovation is very, very important. That's why I am making sure that I am always on point with my uh, with everything, not just with my team, with myself, with my partners, everything. I need to create a little bubble for myself, just for me to be more focused on the things that I want to achieve in the future. So everything that I've achieved now is based on dedication, it's based on hard work, it's based on faith. You have to believe when you ask this to be when you ask a thing, you have to believe, because if you doubt, then don't ask. You believe it first, and then you work hard for it. Work hard for it, whatever it takes. You will know if it's for you. You will know if it's not for you. But don't don't quit. Um, Also, you have to be efficient in everything. You have to be effective in what you're doing. Even up until now, I'm always excited to learn new things. I'm always excited to read articles. But I have life. I have a wife. I have a kid. I enjoy life. I celebrate life. I do workout. I I I play Mobile Legends. I That's it. I make it a point that my I have the clear vision in my mind. I have a clear goal, and yeah, that's it. So I'm gonna yeah. This is my CAD/CAM machine. This is uh the machine that I've been telling you a while ago. It's an innovation in my practice. And also this is an Emax Press machine. So I have two machines for indirect ceramics. And instead of me buying a sports car, I bought this. I invested on this, and I'm happy with the result. Every results I have in my ceramics because of that. And also, this is the T-scan machine. We can be able to check the occlusion if there's any parafunctional contacts. Very, very helpful in my practice. And before I used to just use the articulating paper, but now with one bite, I can be able to scan the teeth. If the distribution is off, then we can be able to balance it instantly. So every patient is important, and saving each of them requires specialized skills and knowledge in preserving every part of it. So that's my parting words. And thank you very much. But I'll be answering question now. You can follow us on our YouTube, uh, Facebook, and Instagram. What's this TikTok? I have a TikTok account also. Apostol Dental. Okay, so I'll be answering this. What do you think are the greatest challenges in completing medical school and becoming a doctor? What made you want to specialize in cosmetic surgery? Yeah, it's real difficult if difficult because of the things that you don't like but you have to learn. It's not what you like, it's what you should know, so that in the future you can be able to go back to where you know, and you can think differently. Because if you have a broad knowledge, you can be able to pick up a lot of things, while if you just shut them down, we are doctors. I mean, you have to be very, very knowledgeable, even if you don't like it. That's it. How many procedures do you perform per day, and how long do they take? Does cosmetic dentistry require a lot of patient communication? I do like 2 smile makeover a day. I can actually do 3 maximum. Uh, about 2 hours per smile makeover. And does cosmetic requires patient communication? Yes, it does. It does, especially when you're like new at it. But now, like in my practice, I don't really talk a lot because they seen my result already, and they kind of knew that my skill level. And I have a YouTube channel that they watched, and explained everything there. So when they come to my clinic, we have like short chatting, and then explain everything, treatment plan, and then we proceed with the treatment, and that's it. That's why I can do like 2 to 3 smile makeover cases in a day. What causes tooth decay? It's actually the bacteria. It's Streptococcus mutans, and most um, culprit are the food that you're eating. Like when you don't brush your teeth, it turns into acid, and it will damage the enamel, and it will proliferate to the dentin and affecting the pulp. And that's it. It will change its color, the vitality of the teeth, the appearance, and also it can infect to other teeth. Um, Caries or cavities, infectious microbiologic disease. It can actually, it's infectious. It's like TB. It's from one tooth to another, from one person to another. So you have to be careful with your teeth. It should be caries free or cavity free, just to protect yourself and others. Why did you choose to open your own private practice instead of working for someone else? I used to work for a dental clinics way back, like 10 years ago. Um, it's because of my vision. I have a vision. I want to create something bigger. And when you're working for someone, you don't have as, you can't do whatever you want. You can't experiment. You can't do a lot of case studies. Right now in my practice, I do a lot of studies, like every single cases that I have or incorporate what I've learned, like new techniques. I make case studies so that, in the future I can be able to share it with people how how effective it is. So, what age group is the majority of your patients? Um, Usually on their mid 20s to 50s, because it's, veneers, cosmetic dentistry, teeth whitening. What procedure is the most high risk for patient? Surgery. Um, High risk. Common. It's more of like surgery on the, like a meloblastoma. It's difficult. It's risky. The teacher resist, but the most risky if the patient has systemic problem. That's the most risky if they're not controlled. If it's not, if it's controlled, everything, if the system is in perfect condition, then surgery will not be a problem. So yeah. How many employees do you have? Do you have an office manager or manage the daily activities yourself? Yes, I do have an office manager, and I have 13 employees in my practice. We actually had 20 before COVID, but now we need to cut down. It's because of you know, we can't operate full time. I do have 5 chairs, but I can only use 3. I have my own laboratory, so I have technicians there, ceramists. Why do most women get cosmetic dentistry treatment compared to others? It's because of their nature. They're women. Enhancement. They love themselves. So I love that. I love to give them the smile that they deserve. So are procedures painful? How do you ensure patient compliance? For veneers bridge, no. We use anesthesia, local anesthesia, just to numb the area to make sure that there's no pain and comfortable for the patient. And patient compliance is like always the problem. You know, you tell them not the do's and don'ts, but it's there. You cannot control that. That's why I have to make my own study that, the teeth should not break. It should not be debonded. I'm doing a lot of modification in my practice to make sure that uh, I do my thing. I don't put the blame on the patient. I always take responsibility for everything. Like for everything, I take full responsibility, especially when I am in charge of the cosmetic procedure. So that's me, and that's how it should be. How does the education path look for someone pursuing cosmetic dentistry? If you're like a general dentist, you have to make sure that you are um, innovating every single time. You have to read books. You have to read journals, articles. You have to make sure that you attend seminars, or like right now, like online courses. You have to equip yourself, because that's the thing. That's the thing in cosmetic dentistry. It's ever evolving. 2 years ago, the material, this material was the best. After 2 years, it's not anymore. I mean, there's a constant change in cosmetic dentistry. Does cosmetic dentistry involve working with other doctors specializing in different areas? Yes. I am constantly working with my periodontist. So she is making sure that the gums are healthy, the ligaments and everything that supports and holds the teeth are healthy. I also work constantly with my endodontist because a lot of patients have this bad cavities that reaches the pulp and it requires root canal treatment. And I also have implantologists that do implants for me. And after that, I do the restorations. So basically, cosmetic dentistry is like restorative dentistry with a touch of like dentofacial aesthetics skill. Um, I think we're good. I think we're good. Thank you very much for the questions. I'm so happy to be part of this, and that's it. That's it. That's it.
Thank you so much for being on My Medical Message. For all the viewers out there, thank you so much for joining today and for your questions. Please make sure to fill out the Google form in order to get your shadowing hours. And yeah, thanks for joining.
Thank you. Thank you. Thank you, Meg.